Juan, Sharon, ever since the beginning of this crisis, we've seen the push-pull of two competing points of view. One, rescue the economy by getting people back to work as quickly as possible, and the other, keep people separated to make sure we can protect them from contracting this deadly virus. Today, it was clear that the president realizes the decision before him will likely be profound.
I'm going to have to make a decision, and I only hope to God that it's the right decision. But I would say without question, it's the biggest decision I've ever had to make.
It is a life or death decision based on a simple question. When is the right moment to rescue the economy by sending people back to work without causing the virus to spread and claim more lives?
I don't know that I've had a bigger decision, but I'm going to surround myself with the greatest minds, not only the greatest minds, but the greatest minds in numerous different businesses, including the business of politics and reason.
According to the Washington Post, the president is hearing from financial advisors who are urging him to open the country up by May 1st. But health experts are saying this is not the time to bring people back together, at least not yet.
We have not reached the peak. And so every day we need to continue to do what we did yesterday and the week before.
What I think that they're talking about is that whenever you pull back, you would expect that you might start seeing cases. And what we've been talking about, what Dr. Birx has just mentioned, is that when you see that, that's where you want your resources to be able to very efficiently, in real time, identify, isolate, and contact trace.
This report from the Departments of Homeland Security and Health and Human Services projects if the president lifts the 30-day stay-at-home restrictions when they expire on May 1st, the death toll could rise to 200,000. Today, the president said he was unaware of those new projections.
They haven't seen it. I guess you're saying I guess they leaked it to NBC.
Dr. Anthony Fauci is talking about the need to have access to widespread test results so people who are infected can be identified and isolated, and those they've come in contact with can be placed in quarantine. The nation is ramping up testing. This week, Walgreens and CVS announced they're opening 17 more drive-through sites, which could test thousands more people. And the CDC just began using its own blood test to look at past signs of infection. But public health expert Dr. Ashish Jha says that's just a start.
We're testing about 130 to 150,000 people a day. That sounds like a lot, but for a country of 325 million people, it's not nearly enough. We need to be doing a lot more.
Test makers like Abbott Labs were capable of processing 1 million rapid response tests in the last 3 weeks. But according to the task force, it ran less than 10% of that. More testing for the antibodies that show previous infection and might tell us who is immune are also coming online. That could get people back to work faster.
Once the infection rates are down, if we have a testing infrastructure in place, we can open up. If we want our economy to stay open, this has got to be priority number one.
But these medical experts say we are not there yet. Today, President Trump said he will listen to the medical experts and the financial experts and make the most important decision of his life.
We're looking at a date. We hope we're going to be able to fulfill a certain date, but we're not doing anything until we know that this country is going to be healthy. We don't want to go back and start doing it over again, even though it would be in a smaller scale.
So today the president did announce that he is putting together what he is calling a council, as opposed to a task force. A council, a group of people who will represent business, financial experts, health experts, and bipartisan group of politicians to all come together to speak with him and to try to help him come to the decision, which he clearly sees now the implications are so profound it could impact the lives of thousands and even hundreds of thousands of Americans. Let's go back to you.
Yeah.